as I said on the last slide, most people do not need to deal with their phobias. They find that just avoiding their triggers is enough. However, in some cases, there are people who do seek help and want to cure their phobia. The first step of that would be talk to either a therapist, a psychiatrist, or a doctor. They're going to be the ones who help you with your phobia. Talking to your therapist is often for some people a way that just talking about it is good enough. But if recommended, a doctor or psychiatrist might recommend that you do one of two things, or maybe a bit of both. Use medication. There are medications that help, or use behavioral therapy, which is, let's look at an example of behavioral therapy. Let's say there's someone who's afraid of getting on airplanes, or flying in planes. So what they'd start is they'd go to a psychiatrist or a therapist. Either one can do this. They'd talk about their phobia with the therapist and think about their phobia a lot until they're used to talking about it and can do that fine. And then next, what they do is they look at pictures of airplanes. They look at pictures of flying on airplanes, and once they were comfortable with doing that, they would go to the place with the trigger of their phobia. They wouldn't interact with it, but they would go there. So the person who's scared of flying would go to an airport and they'd look at planes. They wouldn't get on the planes, but they would go there. And next, they would maybe simulate their phobia by doing a flight simulator, sitting in one of those, seeing if they're comfortable doing that. And once they're comfortable doing that, they'd move to the next step, and maybe they'd board the plane. And they just keep working step by step until they're able to overcome the fear of the phobia and fly just fine. This is normally the safer step. There are also medications, although some of them can be very addictive. Antidepressants is one, which is specifically only for social phobias, since social phobias can often come with social anxiety and being depressed. There are also beta blockers, which that'll reduce the activity of your amygdala, and your amygdala is less likely to produce adrenaline. And sedatives also, and all of these can be pretty addictive, which is what's bad about them. So sedatives is that last one.